Hi, and welcome to today's webinar. Before we get started today, I want to make a few brief announcements. We know many of you are listening in from far away and are unable to attend local events or programs. That's why we provide this free webinar series. We host multiple webinars per month, so please visit our website to view the current schedule for 2018. Simply visit our website at www.johnson-center.org and click on the webinars link on the right-hand side. New webinars and events are often added, so if you are not on our email list, I encourage you to visit our website and click on the Join Our Email List link that appears on the homepage. To get instant news and events from the Johnson Center, follow us on Facebook, Instagram, and Twitter, as we often announce grant and scholarship opportunities, new webinars, research opportunities, and special events and presentations there. And be sure to check out our YouTube channel at youtube.com/The Johnson Center. There you will find a library of several of our past presentations. We have many exciting programs still to come this year, including some fun fall and holiday events. We host a fun, sensory-friendly Halloween party, a fall festival and teddy bear clinic, and much more. We have recently announced a new program providing sliding fee scale counseling services with additional grants for those in need. And our diagnostic clinic now has a number of grants and supports available in order to ensure that our families have faster access to assessment services by our staff psychologist. Follow our Facebook, Twitter, or Instagram pages, or check into our website blog for more information. Be sure to follow our colleagues at the Autism Research Institute as they host their own webinar initiative and they share some great resources on their website and social media pages. If you would like a certificate of attendance after today's webinar, look for a follow-up email in your mailbox 1 hour after the webinar concludes, or look for the link on our YouTube channel in the webinar description. It will contain instructions on how to get your certificate. If you have questions during the live webinar, please type them in your GoToWebinar control panel or email info@johnson-center.org. If you are watching a recording of this webinar, you may email questions to the presenter at info@johnson-center.org. Today's webinar is a Q&A presented by Amanda Tami. Amanda holds a master's degree in counseling psychology and has completed a recertification program in applied behavior analysis. In addition to being a board-certified behavior analyst, Amanda is also a licensed professional counselor. She has experience working with both children and adults, including those who have autism spectrum and other pervasive developmental disorders, ADD, ADHD, anxiety issues, and trauma, both as a BCBA and as a counselor. She has additional specialized training as a counselor in EMDR therapy and its applications to children. Amanda heads up the Johnson Center's Behavioral Services and Counseling programs and is a frequent webinar presenter. Please welcome Amanda.
Thank you all for being here today to be part of this webinar. We have a lot of questions coming in already, so I'm going to do my best to answer as many as I can during this next hour. Before we get started, I want to take a minute to say that I am able to provide general information and suggestions and things to consider during this webinar, but I can't provide any clinical opinions or specific interventions or recommendations because I just don't have enough information about any person through this format to be able to make any clinical decisions. So when deciding how or if to intervene to help your child, it's always a good idea to consult directly with a board-certified behavior analyst or a mental health provider about the specifics of your child's challenges. All treatment plans for both ABA and counseling need to be highly individualized and tailored to that person's challenges and strengths and their needs. So I hope that this webinar will give you a better understanding of ABA and counseling related to individuals with autism or to others and other ideas to consider. So let me pull up my first question. Okay, so this person is asking about her son, who is in his 30s, adult son, fits the old Asperger's criteria. We know that Asperger's no longer exists as a diagnosis. It is now just considered part of the autism spectrum. He was in residential treatment at one time as a young teenager because of impulsivity. but he did graduate at the top of his class and earned a bachelor's degree and is employed. He isolates and has no friends except online. This person says, I tend to think it's because the world is just too harsh and unfriendly for him and he's given up trying. Related to friendships. He's been working with his old therapist from childhood for the last few years for anxiety, panic disorder, and depression. The therapist does not acknowledge that he has ASD. Trauma of residential treatment still haunts him. He's tried a few meds, but this person's concern is that the meds will just mask what he's really dealing with. He makes his own decisions, but this person is scared that he's not getting the help he needs. His reason for working with his therapist is that he feels he can trust this person and no one else. What thoughts do you have, if any? So there's a lot there that I can touch on. I want to first recognize that this person's son has overcome a lot and accomplished a lot and commend him for that. I can't tell you specifically what to do or what to tell your son to do, but I can tell you a few things that you might consider. So I first want to recognize that having relationships with people online is not a bad thing. Many people with autism and even a lot of people who don't have autism find online relationships a safer and more convenient and an easier way to connect with people. Now, no matter who you are having online relationships, you still need to have appropriate boundaries online and follow the social norms of online relationships and be careful not to be taken advantage of. But if he does have support from an online community or a group of friends online, even if he's never met them in person, that's a good thing, and that's a source of support for him. You're right that the world may have been a harsh and unfriendly place, so socializing in person is not just hard because he has autism and might have challenges with social skills, but it might feel like a scary thing to have to do. Online relationships can be a great resource. However, if he actually is isolated and lonely, as you suspect, anxiety, depression, panic, or simply the challenges he might have with making friendships happen may be contributing. And in that case, an effective counselor may be able to help him overcome those obstacles. Now, it sounds like your main question is what to do about the medication and the counselor that he's seeing. So let me talk about medication first. I am not an expert in medication. I can't prescribe medication, so I can't make any specific recommendations, but I will say this. Medication is not always necessary, but it definitely does there is a place for it. So while medication will not make whatever conditions this person is struggling with go away or change their life circumstances, meaning the problem is still going to be there and the person is still going to have to learn other ways of coping and problem solving, medication can bring the nervous system to a state closer to its equilibrium or a state of arousal that is more tolerable, which would allow the person to deal with the problem. If we are so anxious or so angry or so sad that our emotions prevent us from being able to live our everyday lives or respond effectively to problems or think clearly enough to get to a solution or get us out of bed, that person might need medication so that they can get to the point that he or she can do those things that we need to do to function or to solve problems. So while medication doesn't fix the problem, it might help someone get to the point where they're able to deal with the problem in an effective way. I'm not saying your son needs to be on medication, I don't know, but there are times that medication is an important part of treatment. As far as your son's counselor, I would be interested to know whether your son feels like working with this person is helping him. If the therapist doesn't acknowledge that he has autism, that's not necessarily a problem. If they're still able to work on his challenges and his reasons for seeing that therapist in a way that he finds meaningful, the diagnosis that she gives him is not necessarily of concern. Now, if he's not getting any help from this person, or he's not getting what he needs because they are core symptoms of autism and she's not addressing those, then, or he is not addressing those, I don't know if it's a male or female therapist, then that could be an issue. But if your son trusts this person, that is huge. That's very important. Trust in your therapist is maybe the most important piece of counseling. And if your son is socially isolated, being able to trust his therapist is very important. Now, trust isn't necessarily enough. If he trusts this person but acknowledges that he is still miserable or isn't getting any relief by working with him or her, then I would say it's time to find another therapist. So acknowledge for your son that finding another therapist is hard. It is hard to leave a relationship that you know and trust for a brand new one. So you might talk to your son about what he hopes to get out of counseling, help him imagine what life could be like if he could reach those goals and get the help that he needs. And remind him that even though switching therapists is hard, it could be worth it, and that you'll be a source of support for him during what he fears could be a difficult transition. So there are several questions here about self-injurious behavior, or SIB. SIB can be very serious and potentially dangerous, so I highly encourage you, if you have a child or loved one, someone in your life who's engaging in self-injurious behavior, that you seek help from a professional. But basically, here's what we're going to look at when dealing with SIB. So in ABA, we believe that all behavior is communication. A child is doing some behavior to communicate their need. It may be an ineffective way to communicate or a socially inappropriate way to communicate, but it's still their way of communicating. And the same is true for self-injurious behavior. So I would first suggest that you rule out that they're communicating that there's something physically wrong. Are they in pain? Is there something uncomfortable going on inside that they can't tell you about? Excuse me. Talk to your child's pediatrician about the behavior and any changes you've noticed. Has it gotten more or less intense? Has it gotten more or less frequent? Is it a brand new behavior that they weren't doing before? And the pediatrician can decide if they need to do any tests or try any treatment to address anything that could be going on physically that's leading to this behavior. So once you've ruled out physical symptoms, you should work with a behavior analyst to identify the function of the behavior and a plan for teaching a replacement behavior. So in ABA, all behavior serves one or more of 4 possible functions. Functions of behavior are the reasons that we do a behavior. So whatever need is being met. And in ABA, there are 4 possible functions: attention, escape or avoidance of something, access to something in the environment, and automatic. And if it's automatic, the behavior in and of itself is reinforcing. And self-injurious behavior can be due to any one or a combination of those functions. So the behavior analyst will do a functional behavior assessment, or an FBA, to figure out what is the function. And this is critical for behavior change. We need to know why someone is doing a behavior so that we can help them meet that need in a more effective way. If we don't know exactly what the function is, or we try to address the incorrect function, it's likely that some other challenging or unwanted behavior is going to pop up in place of this behavior that we're trying to get rid of. Because, again, the person is doing the behavior for a reason, and if we don't teach them an effective way to get that need met in place of what we're trying to get them to stop doing, they're going to find some other way, some other behavior to communicate that need. So once we have figured out what the function is, we'll find a developmentally appropriate alternative behavior to teach the child to do instead of the self-injury. So I can't say specifically what that would look like for any one child. It really depends on the function and the child's abilities, and it needs to be highly individualized. But I can name a couple of examples to help you think about what that might be. So let's see. I recently worked with a young girl who would bite her arm. And so I conducted a functional behavior assessment to figure out what the function was. And we found that the function was access to something in the environment. Often for her, it was a favorite room, or which was the hallway, or preferred food. And so we used what's called functional communication training to teach her to say the words of the things she wanted. We stopped reinforcing her for the self-injurious behavior. So we no longer let her go out into the hallway, or we no longer gave her those foods that she wanted when she engaged in self-injurious behavior, but we instead would prompt her to say the word of the thing that we suspected that she was communicating to us that she was wanting. And then we would reinforce her for verbal communication by giving her that favorite food or letting her go to the hallway. I worked with a young man a while back who would pull his hair, not pull it out, but he would pull on his hair still in his head. And the FBA indicated that escape or avoidance was the function of the behavior. So he was pulling on his hair as a way to communicate his need to stop something, stop some activity that he was doing. For him, it was usually academic related. He also had trouble speaking at times when he would be pulling his hair. He was highly verbal. He had a very large vocabulary and lots of verbal skills, but he couldn't use those skills at times like this when he was pulling his hair. So for this reason, I gave him a Batman break card. He loved Batman. And I taught him to give his teacher or the therapist the break card instead of pulling his hair. And then he could have a break from what he was doing. He was getting the need met, but in a more effective and more communicative way. Now for this particular person, we had to watch for kind of precursor signs to pulling his hair, and then prompt him to use the break card before it got to that point, because once he was at the point that he was pulling his hair, it was very difficult for him to even hand someone a break card. He was kind of in kind of a meltdown state, or close to a meltdown state by that point. So we had to learn the signs that this behavior was coming and prompt him to do it before it got to that point. But he did eventually, with lots of practice, learn to recognize those precursor signs himself in his own body and ask for a break. My teenage son has high functioning autism and is struggling with anxiety. How will counseling help him? He isn't very communicative about his feelings and usually just gives us the answer he thinks we want to hear. Won't he do the same in counseling? Excuse me. So that's a good question. So first, for counseling to be effective, a client does need to be motivated to be there and participate. Now, at first, some people, especially teenagers, are not motivated to work with a counselor. So the counselor will have to work with that person to get their buy-in, to show the person that they truly can be helpful. But if the therapist can't get that buy-in from the client, it's often difficult to make progress. But the right therapist will be able get that person's trust and willingness to participate. Now, for this case, I would ask, does your teenage son tell you what he thinks you want to hear because he doesn't have the knowledge or the insight into his own emotions to tell you what's really happening? Or does he tell you what you want to hear because he's trying to please you, or doesn't want to disappoint you, or doesn't want to worry you? Or does he tell you what you want to hear to kind of get you off his back? Whatever the answer, each of these is something that a counselor or doing therapy can help someone help with. Identification and insight into emotions is a big part of a lot of therapy, not just for people with autism, but even for adults who are neurotypical. It's a lot of people don't have a lot of insight into their emotions, or can't tolerate their emotional experience. So a therapist can help with that. If it's because he doesn't want to disappoint you, or he doesn't want to worry you, or he's trying to please you or make you happy, again, this is something a therapist can help with, and importantly so that your son can advocate and get his needs met rather than putting others' needs first. And what if it is because he just kind of wants to get you off his back? He just doesn't want to talk about feelings with you. Well, a therapist might be able to help your son to communicate his boundaries, or a different style of a different way that he wants you to communicate with him. Or the therapist might be able to work with both of you kind of as a unit to teach better communication and other ways to read each other, so that he won't feel like he needs to get you off his back so much. Or if this is just not something he wants to talk about with a parent, which is understandable for teenagers. There are just some things that teenagers don't like to talk about with their parents. Having a therapist can give him another safe person to talk about for things that are uncomfortable for him talking about with you. Are there any special skills or training a counselor needs to be able to work with people with autism, and how does someone go about finding someone who can do this? So there is not special training that a counselor needs to be able to work with people with autism, meaning there's no additional schooling or credentials or anything like that that someone would need to get. However, counseling for someone with autism can require some modifications and can look different than counseling might for someone without autism. For example, counseling for someone with autism might need to be more directive, more led by the therapist rather than allowing the client to lead. It may need to be more explicit in guiding change. It might require more repetition of exploring ideas and outcomes, or use of strategies. It might need to incorporate more visuals or experiential exercises, and maybe rely more on art or play or other forms of expression rather than just talking about the problem. I want to emphasize that these modifications might be needed for someone with autism. They are certainly not needed for all individuals with autism, but a counselor may need to be able to think about things in a different way and help to create change in a different way than they might for someone without autism. I would also say that a counselor who's working with someone with autism needs to have a really good understanding of autism and know what the symptoms are, what are the core features of autism, and what symptoms are true indications of anxiety or depression or addiction or whatever the person is seeking counseling for. The opposite is also true. A counselor needs to be able to identify when one of those co-occurring disorders, like anxiety or depression, when one of those is present, and not just lump all the symptoms into autism. So for example, someone with really intense perseveration tendencies might we know that perseveration is a symptom of autism. It's something that people with autism do, but perseveration can also be an indication of anxiety. And is the therapist able to differentiate between what's going on in this case? As far as finding someone who can work with your child with autism, although most therapists do not have, sorry, I was reading the next question. Although most therapists don't have experience working with autism, there is growing knowledge of autism and a lot more providers who are learning to work with this population. So that's great news. A lot of therapists who do work with people with autism will include that as a specialty on their website or on their profile on websites like Psychology Today. So that can be a good place to start. If not, if there isn't someone in your area who identifies that as a specialty, I would suggest doing brief interviews with potential therapists. Many therapists will do a free 15 or 30-minute consult with potential new clients. And you can ask them about their experience with autism and whether or not they would be willing to do research outside of sessions or get more training so that they would be able to effectively work with your child with autism. Also consider the age ranges that a therapist works with, and choose a therapist who works with your child's developmental age. So if your child is 14, but developmentally is closer to 8, choose a therapist who works with children rather than adolescents. How young should you start counseling for a person with autism? So there is no single or correct answer to this. It really just depends on their needs for counseling and their level of development. Now, not all kids with autism or people in general need counseling. But if a child with or without autism is having challenges or experience that require the help of a counselor, some therapists work with kids as young as 2 years old. Now, a child with autism might be much younger developmentally than their chronological age. So as I said before, I would just recommend that you look for a therapist who works with children who are your child's developmental age. We already have an ABA program for my son. Does that mean he doesn't need counseling? He's working on social skills, communication, and academics in his ABA program. What more could counseling offer? So ABA and counseling would work on different things. Some kids need an ABA program, some kids need counseling, and some need both, but certainly not all need both. So in an ABA program, a child is going to learn the skills that are delayed, like language skills, social skills, play skills, academics. If a child has areas of development that are behind what would be expected for someone his or her age, ABA is the place to go. Counseling, on the other hand, addresses performance of those skills. I know what I'm supposed to do in a given situation, but I'm not doing that. I'm not doing what I'm supposed to do. Is there something that's getting in the way? Is there a barrier to using those skills, like social anxiety or emotion dysregulation? This is not specific to people with autism. Counseling serves this same purpose for anyone. So, for example, I might have the skills to handle conflict effectively or to advocate for myself or say no when someone asks me to do something I don't want to do. I know what I'm supposed to do and say, but when it comes time to confront someone or to say no when someone is pressuring me, maybe I'm too afraid to do it, or I don't want to just disappoint someone. So through counseling, I can decrease that fear enough that it will allow me to act even though I'm still a little bit scared. Or let's say someone has been getting social skills instruction through their ABA program, but they're still having a hard time taking the steps that they need to form friendships. Is it because they need more targeted instruction or instruction in real life, more authentic environments so that they can generalize what they have learned, how to form friendships, and their social skills instruction. If so, then they need to modify their ABA program. They would modify the ABA program so that it's taking place in real life settings or taking place in a way that will allow it to better generalize. Or is it because they're too anxious to talk to a new person or to use the skills that they've learned they need to do? If so, then counseling can help them to manage their anxiety so that they can use the skills that they've learned. Okay, I have a question about how many hours of ABA are needed per week, and I can't give a specific answer to this because, again, it's always individualized to each child's needs. Generally, the recommendation is intensive intervention for children 5 years old and under, which would be 25 to 40 hours of ABA therapy a week. The exact number will depend on their level of need and their skills, which would be determined in a skills assessment before the start of therapy. A skills assessment looks at a child's level of development in all of the domains of functioning, all of the areas of life, and compare that to what would be expected for a child their age. The skills assessment shows us which domains are delayed and which skills and how far behind they are. And the bigger the delay, the more important it is that the child gets more hours. However, there are other things to consider as well, like does the child take a nap during the day? If so, then 40 hours a week might not be possible, and that's okay. If a child needs to nap, we need to get them a nap. They likely wouldn't have the stamina to be engaged for a 40-hour-a-week program if we're not letting them have a nap that they need. Or does the child get any service at school or other therapies that are effectively intervening in these areas that we've identified as delayed? If so, maybe your child doesn't need quite so much ABA. Is a PPCD program structured and effectively helping your child build skills? Maybe for your child, some combination of PPCD and ABA is the best fit. The number of ABA hours per week really depends on your child's skills and areas of need. There's a question about how parents can implement an ABA program, especially someone in a rural area who might not have access to help from a BCBA. So it is very important that you have someone who is a specialist in this field to guide you. While parents can't be highly involved and do much of the therapy themselves, it is essential that you have a specialist to create the program, do a functional behavior assessment, and develop a systematic intervention plan for you and monitor your progress. Parents can be the one implementing all of the interventions, or parents can hire therapists themselves who would be supervised by a behavior analyst or behavior specialist. Now, what if you're in a rural area or an area where there aren't behavior analysts? Behavior analysts are able to provide remote supervision, which means the behavior analyst can still help you and oversee your child's ABA, even if they don't live in your area. You can look up providers in your state on the Behavior Analyst Certification Board website. They have a find a certificate section where you can put in your state or your zip code or your area and see who is nearby or who is just within the same state. Now, depending on which state you're in, there might be restrictions on whether or not someone from out of state could provide supervision. I know a lot of states now are requiring licensing for behavior analysts, and in that case, it's likely that if your state has that requirement, that they would say only that you could only work with a behavior analyst who's licensed to practice in your state. But it's different for each state and different requirements depending on where you live. But I would suggest that you look on the Behavior Analyst Certification Board website and search for someone who is in your state or possibly even in your general area. This person is asking about their 6-year-old son who has has autism and has a lot of anxiety issues, repeats himself over and over, and screams when stressed or has other behaviors. The BCBA has no advice on how to calm him because she wants to work on the behaviors, which is understandable. However, I would like to see more CBT incorporated into his ABA therapy since thoughts and behaviors are so interlaced. Does he need a different kind of therapy, or is there another theory that can be added to ABA? He needs stress-reducing programs, and we're not getting that through his current ABA, and I'm not sure where to get it from. So a BCBA would not be able to incorporate CBT practices into ABA work. CBT is cognitive behavior therapy, and CBT is one type of therapy that has been shown to be effective for a lot of people with autism, but a BCBA would not be able to incorporate CBT into ABA. Number one, because most behavior analysts are not trained in CBT. CBT is a counseling technique, and behavior analysts don't get that kind of training. But also because a BCBA is ethically required to only use intervention skills, strategies that are behavior analytic in nature. So they are ethically required to look at the function of a behavior and create a behavior intervention based on that function. And CBT would not fall within that requirement, or they can't use CBT because of that requirement. So yes, you would want to find another type of therapy. You would want to find a counselor who can provide CBT, or there is a modality of therapy that is called acceptance and commitment therapy, or ACT, which also you could find a counselor who can do that. But a behavior analyst may be able to incorporate pieces of acceptance and commitment therapy into an ABA program. Acceptance and commitment therapy was actually designed by psychologists and behavior analysts together because they saw that things that happen internally have behavioral consequences, that a behavior can be based on something that's happening inside of the body or inside of the mind. And although we can't see those things, they do still have an effect. So if a BCBA has training and is able to knows how to use acceptance and commitment therapy, that is a possible option. Okay, someone is asking about really severe behavior problems for her granddaughter who has autism and is 15. When she doesn't get her way or doesn't get what she wants, she uses her knee or sometimes her head to put holes in the wall. She lists some other triggers. Medication has not been helpful. So in this case, we again would want to start with a functional behavior assessment to figure out exactly what it is that she's trying to communicate. What are the conditions under which these behaviors happen? And then once we figured out which of the 4 functions it is, the behavior analyst or other behavior specialist would create an intervention to teach a replacement behavior. So whatever it is that this person is communicating, whether that's I really want something, or I really don't want to do something, or I hate waiting, whatever it is that they're communicating, whatever we determine to be the function, we'll teach that person a more appropriate way to communicate that need, or to communicate whatever it is that they're communicating now by putting holes in the walls, or by using her need to hurt someone or something. So we would use the same intervention process of finding the function, determining a replacement behavior, and then reinforcing only the replacement behavior and not reinforcing hitting the wall with the knee or the head, or these behaviors that we're trying to decrease. And I can't say in this case exactly what that intervention would be or what the function is, because like I said, I just don't have enough information in this format to be able to make recommendations or decisions like that. But that is basically the process that a behavior analyst would follow to create an intervention for a behavior like this. Now, I do want to mention that it's my belief that that behavior serves a purpose, and that this person might be communicating that, you know, that something, that they want to escape something, or that they want access to something, and they have learned over their lifetime that by hitting the wall with my knee, I get this thing that I'm looking for, that I'm wanting, or that I need. But it's also possible that someone has really extreme behaviors when they get so emotionally dysregulated, or so anxious, or just in such a heightened state of arousal, that they just can't think through the consequences. They can't think of a better way to get their need met, that when they just get so overwhelmed, they just act maybe aggressively, and it's really kind of out of their control. And in that case, we need strategies to help this person bring down their nervous system, to re-regulate their emotions. And so if that is the case for someone, we need to find out what does help this person regulate. What kind of sensory strategies can we put in place to help someone, you know, bring down to calm down? Does a person like to be under a weighted blanket? Do they like to play with silly putty? Do they just need a few minutes of downtime to watch their iPad? What does help this person calm down? And if meltdowns like this are happening a lot, we want to incorporate those calm down strategies into their daily routine. So even before they start to show these behaviors, even before they start to seem like they're getting upset, or getting frustrated, or getting to that point where they might have a meltdown, we want to be doing these behaviors or doing these strategies throughout the day. So every hour, maybe we get 5 minutes of iPad time, or at different times during the day, maybe we take a few minutes to be under the weighted blanket. Incorporate it into the routine so that we help to prevent them from getting to the point that they get to that crisis mode or that meltdown mode. Question about sound sensitivity. It's a problem with certain sounds at home, but now at school they've started having fire drills, and it's a problem now at school. They've tried noise canceling headphones, but he won't wear them. Okay, so although sound sensitivity is not we can't see what's happening in someone's ears to be able to say this noise is the cause of this behavior, or basically what I'm trying to say is some people would say we can't say that sound sensitivity is a behavioral stimulus, or we can't say that it's because of the sound. We know from people who have sound sensitivity that loud sounds can be very distressing. I believe it was, and I could be wrong about this, but I believe it was Temple Grandin who described loud noises as her reaction to them as shell shock, basically, kind of a trauma response, that she's so hypervigilant now about possible sounds that she's always looking over her shoulder for what's going to be the next really loud sound that's going to, be so painful and so distressing to her. So I just say all this to say sound sensitivity is real. It is a real experience that people have, and I know that sometimes people discount it or don't understand it, but I want to acknowledge that it is real. But unfortunately, the reality is sometimes we can't avoid loud sounds. We don't know when they're coming. If we're in school and there's a fire drill, or God forbid a real fire, that alarm is going to go off, and sometimes we can't avoid the loud sounds. Whenever possible, when we do know that a loud sound is coming, give warning. Let your child know that there is a loud sound that's coming, that they can expect it, and help them come up with a plan for what they're going to do. So luckily, it sounds like at school, when the fire alarm goes off, he gets to go, he knows beforehand and can go outside before it even starts, so that's great. But even outside, it bothers him. You might incorporate some sort of reinforcing activity, or reinforce him for tolerating the sound, even though it feels bad. I can see that you're able to do it. I know it's hard, but you're able to do it. And maybe he gets to be on his iPad or get some other sort of reinforcement while he's outside, so that he can, it's number one, kind of a distraction, but it also, helps him to deal with it in an effective way, by remaining calm or by staying in control of his body, even though this feels really bad. Also, you can use reinforcement to help him to learn to wear the noise canceling headphones. So if he understands an instruction to put on the headphones, and then you tell him that he's going to put on the headphones for 5 seconds, and then he gets reinforced. He gets reinforcement of whatever is reinforcing to him. And then maybe you increase it to 10 seconds, and then 30 seconds, and then a minute, and then gradually keep increasing the time that he has to wear the headphones to get reinforcement. And by doing this, you make him more willing to wear them, because he's learning that it's not so bad, or that it doesn't feel that bad, or that he can handle it. And he's getting reinforcement for it. So he's learning that if I do it, I get reinforcement. And then once it's time, he learns that if he wears them, he doesn't have to hear that terrible sound that he really doesn't like. If he wears the headphones, it's reinforcing, because he doesn't have to hear it's negative reinforcement. He doesn't have to hear this aversive sound that he really doesn't like. Can you expand on what functional communication training is, and who in the school provides this to the student? Excuse me. So functional communication training is a type of ABA intervention where we're teaching the child or adult a functional way to express, to tell another person what it is that they want or need. So functional communication training is teaching someone to use either words or pictures or sign language or some method of communication to tell us what to tell us what they need or tell us what they want, instead of needing to use aggressive behavior or just any sort of behavior that is not effective in communicating what they need. If what someone needs is water, the functional way to communicate that need is by saying water, or by pointing to the picture of water, or even pointing to the water jug or the cup for the water. That tells us, that is a way that we communicate that tells the other person exactly what we're asking for. If our way of communicating that we need water is by, tapping our fingers together or hitting someone or screaming, we only know that that person wants water based on our experiences with them, or based on the functional behavior assessment that we've conducted. It's not immediately obvious that stomping my feet means I want water. So we instead teach a person a more functional way to express their need, which would be by verbal or sign language or picture or pointing or some sort of communication. And this is kind of a cornerstone in ABA, because we're always looking at teaching someone the most functional way of getting their needs met. So who in the school provides this to the student? There is probably not any one person in the school whose job it is to teach functional communication training, but you can get functional communication training written into an IEP so that people working with your child in the school will know that one of the interventions we're going to use for this child is teaching him or her to use some form of communication to tell us what they need. And a behavior intervention plan should incorporate this if that's appropriate. If there are challenging behaviors, a behavior specialist at the school should be writing a behavior intervention plan. And it's great if a behavior intervention plan can include functional communication training, so that the student is not only learning not to do that challenging behavior anymore, but they're also learning an effective way to express themselves, to communicate what they need. Okay, I think I have about time for one more. What are some of the functional assessment tools? So a functional behavior assessment is based largely on observation and data that we collect that we can then look at to find patterns in behavior. So there's not an actual assessment test or some sort of evaluation that we use. Instead, we use what's called ABC data, or antecedent behavior consequence data. So every time this target behavior happens, we would write down what was the context, what class were we in, what were we doing at home, what was going on in the environment, the antecedent, which is the stimulus for the behavior, what happened immediately before the behavior started. So did someone ask the child to do something? Did another child take the toy? What happened immediately before the behavior started? What did the behavior look like? Was there screaming, crying, hitting? And it's important that we include this because we expect to see patterns. And so if we're seeing different sets of behavior, sometimes it's these behaviors, sometimes it's these behaviors, we might be looking at different functions or different situations. So it's important that we include detailed information about exactly what the behavior looked like, and then the consequence. So what happened right after the behavior? Did the child who took his toy run away with it? Did the child give the toy back? When you asked the child to do something and they yelled at you, did you say, okay, forget it? Or did you say, you can't talk to me that way, I need you to do this? What happened immediately afterward? And then how did the child respond to that? What happened next? And so every time the behavior happens, we record all of this information. And then the behavior analyst will look at all this information and look for patterns. Okay, whenever this happens, this seems like it must be a trigger. So let's look at this. Or, okay, every time this happens, the work gets taken away. So that would suggest that it might be related to escape as the function. So there's not an assessment tool per se, but rather it's all of the data that we collect based on what happens before and after a behavior. And it is just about 1 o'clock. So I want to thank everyone for being here today. Thank you for taking part and sending in all these great questions. I apologize that I didn't get to nearly all of them, but hopefully we can have another one of these webinars. Obviously, it's important information and something that a lot of people have questions about. So I would love to do another one in the future. Please follow the Johnson Center on Facebook and Twitter and Instagram. Sign up for our email notifications so that you know when our upcoming webinars are. And all of our past webinars are archived on YouTube, so you can access those at any time for free. And please contact us about our services or with any questions about this webinar, and by phone or email. And thanks so much for being here. Thanks for participating.